Hi there.
Hi.
Alice?
Yeah.
Hi, my name is Jonathan. How are you doing today?
I'm okay. I'm a little bit nervous.
Okay, well hopefully we can calm some of those nerves.
Yeah.
All right. Well, it's very nice to meet you.
Nice to meet you.
Okay. So I heard that you're coming in today because you wanted to discuss the carbamazepine that you've recently been prescribed to treat your epilepsy. Is that correct?
Yeah.
Okay, well we do have a couple concerns about it, but first I'm going to get some background information on you, okay? So I heard that you're a student, is that correct?
Yeah, I am.
Yeah, where do you go to school?
NC Central.
That's great. Yeah, and what do you study?
I'm studying art right now.
Perfect. Okay, and does your family have any history of epilepsy?
Yeah, my mom's sister has epilepsy.
Okay. And I saw in your chart that you identify as Asian American, is that correct?
Mm-hmm. Yeah, my mom's mom is, I'm pretty sure, Han Chinese, from what I know.
Okay.
Mm-hmm.
Good. Well, thanks for that information. So like I said, we originally thought of prescribing carbamazepine for you to help control your seizures, but I'm concerned because there's been some studies that show that carbamazepine, specifically in Asian populations, can cause a serious reaction.
What kind of reaction?
It's called Stevens-Johnson syndrome, and it causes inflammation and ulcers in the type of tissue that makes up your skin, and it lines the insides of your stomach and your intestines, and your nose, your eyes, your throat. So it can be pretty bad. At times, it's even been fatal in certain patients. So it's something that we definitely want to avoid if we can.
Yeah, that's really scary. What causes it, and how do we know if that's going to happen in me?
So it's a genetic reaction, and what it is that there's something called an allele, which is a variant in your gene, and it's the HLA-B 1502 allele. And that's not something, I know that's a lot of letters and numbers, and you don't have to memorize that, but that certain type of allele is more common in certain Asian populations than in other populations. And there was a study that was done that established a reaction or a connection between the Stevens-Johnson syndrome and that allele, and it specifically looked at people of Han Chinese ancestry. But there's also other research that shows an increased risk in other populations, specifically Asian populations like the Malay, Thai, and Singaporean as well. And within these populations, the allele is known to cause an increased risk for Stevens-Johnson syndrome. However, there are other populations such as Japanese, Caucasians, Africans, that don't have the same chance of carrying that allele, and they don't have as big a chance of having this adverse reaction as the Han Chinese and some other Asian populations do.
Yeah, so I'm only part Han Chinese, so how do we know if I have that allele?
Well, what we can do is we can order a genetic test for it, and that will look at your blood, and it will see if you have the HLA-B 1502, that allele that is more common in Han Chinese ancestry.
Okay, how does it do that? How does it tell?
Well, what we would do is we take a small sample of your blood and we'd send it to a lab of some sort. So LabCorp or Quest Diagnostic, and they're going to perform what's called a carbamazepine hypersensitivity test. And they're going to determine whether or not you have a copy of that allele by analyzing how your blood interacts with the drug. They separate the cells from your fluid of your blood, leaving just the plasma, and they modify little particles of the drug in it. So it can be found by antibodies in your plasma. So basically, in layman's terms, what's going to happen is they're going to take a little bit of your blood and they're going to put it on a little scope, and they're going to test it to see if it's going to clump up. And if it clumps up, that means that you are going to have a hypersensitivity, that you do have this allele, and you're more likely to have this hypersensitivity reaction.
Okay, well I'd rather have that happen in a lab than to me and make me sick. So if that happens, then what do we do? So
if we find out that you are positive for that allele, that you do have the allele that puts you at an increased risk, we are going to consider alternate forms of therapy to treat your epileptic convulsions so as to reduce your risk for the bad skin side effects, the Stevens-Johnson syndrome, that could be potentiated by carbamazepine.
So what are the other treatments that I could get?
Sure. So we look at other anticonvulsants. There are other ones out on the market that don't have that correlation with Stevens-Johnson syndrome, like valproate or valproic acid. We would want to avoid phenytoin because it also has an increased risk for Stevens-Johnson syndrome for persons who are positive for that allele.
So those other ones, do they work as good as the first one you're going to give me?
Well, carbamazepine is the first-line treatment for epilepsy, and those other drugs aren't first-line, they're second-line treatments, but they are approved by the FDA for treatment of epilepsy. And what I'm really concerned about is just keeping you safe. And as your provider, I would recommend that we refer to a second-line treatments if you were to test positive for this genotype. And we can reconsider the decision of going for a second-line treatment or a first-line treatment should the second-line treatment not adequately control your seizures, because I understand that is also very important for your safety.
Yeah.
The FDA recommends that we only use carbamazepine in clients who are positive for the genotype if the benefits outweigh the risks.
Okay. Well, I'm kind of worried about having seizures in class.
Right.
Do you think that'll happen?
You know, what we're really trying to do here is keep it as safe as possible. And so these second-line drugs, if you were to test positive for this allele, they've been known to adequately control seizures as well. They are approved by the FDA. And so hopefully you'll run a very minimal chance of having seizures in class, and these second-line drugs will control that.
Okay. And I don't have a lot of money. I'm a student.
Right.
And I just applied for the insurance through the Affordable Care Act.
Yeah.
And I think that will cover necessary prescriptions. So is the second-line drug still considered necessary and it'll cover it?
Absolutely, yeah. If we decide that the second-line treatment is going to be the most effective for you and the safest option for you, under the Affordable Care Act, that prescription is covered for you. And do you have any concerns about identifying as Asian American? You said that your grandmother had this allele. Do you have any concerns for in class or anything like that? Or having this allele, any sort of social disparities that you might encounter?
I think I'm comfortable with it. I've never been certain if my grandmother was Han Chinese or what specific lineage she came from. So I guess that'll be interesting. I'm not just necessarily worried that it'll affect me socially, but I'm curious to see what this test can say and if it'll kind of speak to that.
Great. Well, do you have any other questions for me? Any concerns?
No, we'll see what the test says.
Okay.
And if I can take the medicine or do a different one.
Well, sometimes I know that I can speak a little bit fast and some things I say can be unclear. So I was just wondering, could you kind of tell me a little bit about what our next steps are going to be?
Okay, so you guys will just take a little blood sample and send it off to a lab, and they'll see if my blood interacts and has a bad reaction with the carbamazepine. And if it does, then I won't be able to take it, and I'll have to try another one, a different one that's not going to cause that reaction.
Yeah, that's exactly what we're going to do. So I think what I'm going to have you do is just sign a consent here, saying that you're consenting to the genetic test. And we'll go ahead and get a blood sample and get you on your way, okay?
Sounds good.
All right, thank you so much.
Yeah. Made me feel a lot better.
Good.